Let's put this to Richard Sloggett, who's Senior Fellow at Policy Exchange's Health and Social Care Unit and served as a special advisor to Matt Hancock. I imagine, Mr. Sloggett, you support it and he had no other option. Good morning to you.
Well, good morning, Nick. Yeah, I think this is very, very welcome news, actually. And this has actually been talked about for about the last 2 years, whether this debt should be written off, and it's been sort of mounting over that particular time. I think what COVID-19 has done is it's brought it, obviously, to the fore. We want the NHS to be prioritising treating patients, not paying back historic debts. And the Chancellor last month in his budget said the NHS will get whatever it needs. There was some money allocated then, but clearly more needs to be done. And we want, our frontline doctors and nurses to be focusing on patients and not paying back this legacy debt. So I think the COVID-19 crisis has brought that into the fore, and this is a welcome move which enables the NHS to focus on what it needs to do in the present environment.
What does it mean to the NHS, Richard?
So I think what it means is that the debt payments that were being made, and some of these debt payments go back to sort of 2014-15, and NHS spending has been protected over the last few years, but it hasn't risen at the same rate of the level of demand that the system has been facing. And also inflation in healthcare runs higher than the overall economy. So basically what had been happening is that the sort of certain parts of the system, certain hospitals, were not able to balance their sheets effectively, and therefore racking up those debts, were having to pay those back, which they were unable to do. So this money has been sort of cycled around the public sector. There was a strong feeling, Nick, that this money was never going to be paid back by those hospitals. And I think in this particular crisis, given how unprecedented it is, this is the right move at this time to sort of reset that sort of financial recycling and put the NHS on a stronger financial footing for the longer term, and as well as responding to clearly what is a very difficult situation at the moment.
Can't let you go without having a word on Matt Hancock. It's fair to say he had been getting a lot of flack and a lot of criticism for it is perceived to be a rather flat-footed response. I have to tell you that newspapers across the board today are praising his performance yesterday. Where are you on this?
So, I mean, I think Matt is one of the most capable cabinet ministers, and what you're seeing is, I think, the value of somebody who's actually now been in a cabinet job for about 18 months. There's often criticism that ministers and secretaries of state move around a lot. Matt was retained after the election in December 2019, has good knowledge of the health and social care system. It's the right man to be tackling this crisis. What you saw yesterday was a person coming out of self-isolation and very much trying to get back on the front, getting the government back on the front foot after, as you say, a few days where things have been more difficult. So,
Richard Sloggett, thank you, Senior Fellow at Policy Exchange's Health and Social Care Unit, and you served as a special advisor to Matt Hancock.